My name is Chloe Costello and I am Peer Recovery Educator of Discovery College West. Recognising lived experience is important because it's more than just a perspective, it's a powerful form of knowledge, and it comes from people that have walked through the system and they've felt the gaps, they've experienced the challenges, and they know what it is that works really well. And when you truly start to listen to those voices, you start looking at the system in a different way. So you stop looking at it through policies and procedures, and instead you look at it through the eyes of those that are affected by them. Recognising lived experience, it honours the real stories of people, and it acknowledges that they hold valuable insight that no textbook or degree could ever teach. When you invite the lived experience around the table, you're not just asking them to share their stories, they get to shape the solutions. And from that, you create services that are so much more compassionate and empowering and empathic. We really just empower communities, and most importantly, instead of doing things to people, you start to do things with them.
Hi, I'm Maggie McDonough. I am Primary Healthcare Coordinator in Balbriggan and Travers Project. Balbriggan and Travers Primary Healthcare Project is based in North Fingal. We work with travellers throughout the Fingal area to signpost them to services, to create relationships with the service providers to try to bridge the gaps of travellers accessing the services. As an Irish traveller, I want to use my experience of resilience, identity and overcoming barriers to support other travellers in their journey. I know what it feels like to face stigma and exclusion, and I want to ensure voices from the community are heard and valued. My story can help bridge understanding between services and the traveller community, making supports more accessible and respectful. So I use my lived experience to develop cultural awareness training for services like TUSA, HSE, schools, nurses, and this is to go towards, I suppose, helping people who are working within these services to support travellers. They may not know anything about travellers, only what they've heard, haven't actually experienced it, but also to, I suppose, show them the reality of travellers' lives, to understand the issues the travellers are facing and what they can't overcome because there's too many pressures in place, too many barriers in place. Show them that an awful lot of travellers live in isolated areas with no public transport, so if they are missing appointments, it could really be down to the lack of transport, it could be that they're too far away to be able to engage, or it could be the fear of services because they might have had prior engagement with services and it could have been negative, so it's kind of scared them away a little bit. So it's, I suppose, building their capacity to be able to work with travellers, so when a traveller does access support, that they're more capable of working with that individual.
So over the years working as a peer support worker, I've been in MDT meetings, and coming in with lived experience, sometimes I felt inadequate as well, because you're with people that maybe have gone to further education and heads of services and things like that, and I was asked for my opinion on certain cases, and the lived experience I was able to come from the participants' point of view. Sometimes there was goals or targets set which were quite they were realistic for some people, but for the type of vulnerable people we were working with in the homeless section, they were unrealistic. And from my experience then, I was able to say, look, can we break this down a bit, or or maybe this person, like, this is enough for them, that we don't have to push these expectations on the participants. And I would then go and sit with the participant and explain, look, this is after being suggested, how do you feel about linking in with this service, or going here or going there, and I'd talk them through it, and then I'd bring them along and I'd go to the appointment with them, and the initial assessment, and do all that. And that was only from me sharing my lived experience with them. And where I'm at now today, I'm working as a youth worker in the area where I grew up, and the young people that I work with are harder to reach. It's youth diversion work, and again, my lived experience, You know, I've grown up in a block of flats and there's criminality and there's not much money and there's all this stuff. So, you know, I can share little bits about my story and the young people are relating and, you know, it builds a relationship. And that's what you get with lived experience. You can't learn this stuff from a book, you know. I've been through all these different things and I share my experience and then I encourage the people that I'm working with, and my past can help someone else's future.
I chose to work in a lived experience role because from my own personal experience, when I was struggling with my mental health issues, when I felt that I didn't have any hope, when I felt disconnected from society, I received a unique type of help. And that type of help is called peer support, where people also with their own lived experience of mental health challenges support each other. And it's the wisdom that they have in their recovery that can be used to help other people. It certainly helped me, and it helped me get on the journey of recovery where step by step I started to re-engage more with my community. I started to take on more meaningful roles, and I feel that the place where lived experience and peer support is needed the most is in the mental health services, where many of the people in our society are the most marginalised, most disconnected. They feel that there is no hope for them. They feel that they might be linked with the services forever. And I think it's very important to have people employed in the mental health services who can offer that hope that I received from others, so that they can feel more hopeful about the future, more hopeful that they can look forward to tomorrow, next week, next month, next year, with true hope.
Well, we've had as a peer support worker on our team since 2017, so we've a lot of experience of working with peer support workers, and it's invaluable. Our peer support worker engages with people who generally would have traditionally had a lot of difficulty engaging in clinical areas, and we've had a lot of success with good engagement using peer support work and the model. Often it won't be in a clinical setting, it'll be outside of core clinical settings, a little bit more time, a little bit more relaxed, green spaces, walking in wooded areas, walking and talking. And sometimes not an awful lot of talking is done. It's being present with somebody, being with somebody down by some water in a blue space, and that feels very unthreatening and very safe. And yet there's work being done, that level of engagement to be done. And that's what's happening. We're seeing this then as we're going through the iterations of care planning, recovery planning, and had success with people moving from rehab recovery. And yeah, the therapeutic relationship is forming at a different level with peer support work. But the peer support worker attends our team meeting every week. And the lived experience, I think, gives us room to pause sometimes as clinicians. Certainly when we hit a clinical conundrum, sometimes the perspective of that lived experience is very important. So we find that very helpful in my team and in other teams that I've just got to interface with as well if peer support work in our area.
My name is Michael Saifu. I'm a physically disabled person. I am a full-time wheelchair user. I have been involved in disability activism for several years now, and I'm currently working as a policy officer at Independent Living Movement Ireland, which is a disabled persons organization. One way I used my lived experience perspective to help improve a service or a system was by encouraging others learn from my experience on what works and what does not work. To me, the real test for the success or otherwise of a system is the extent to which it manages or it matches with the needs of service users or people which is the system was meant to serve in the first place. So I use my lived experience to dissuade service providers and policymakers from second guessing what disabled people want, instead of making disabled people an integral part of the whole process. Well, I chose to work in a lived experience role because there is a lot I can share from my own experience to make services and policies better. That's one reason. Another reason is I use it to encourage other disabled people to be aware of their rights and also appreciate the values of having a collective voice. lived experience brings a unique value in terms of improving the user focus of services, and it also encourages a sense of ownership by those affected most, like disabled people. Disability is first and foremost the lived experience. People could have some knowledge about disability by reading books or take college courses or having a disabled family member. But all this in no way can grasp what disability is as much as we disabled people who live it 24/7. If service providers and policy makers want to make real and positive changes to the lives of disabled people, I believe their first port of call should be disabled people themselves, having their lived experience in decision making from the start.